Okay, good morning. Welcome to House Human Services, Wednesday, May 6th. And this morning we are picking up some testimony on both our oversight and accountability, but also with regard to H660. Because in H660, the Senate Health and Welfare Committee, and it looks like the full Senate is poised to vote on 660 tomorrow. And it includes and it is the addition of $1.1 million for the Overdose Prevention Center in Burlington. And saw a news story this morning on WCAX around the sort of three general locations that have been identified. So we wanted to get an update from the city of Burlington and from BCJR and the health department in terms of their oversight of this project. So welcome, Teresa. It's nice to see you. And the floor is yours. I just opened up my laptop, so I'm not sure if we have any documents from you.
Good morning. I am I sending that written testimony just as I was logging in. Sorry about the delay on getting that to you. So I just sent it to Lori. Thank you for allowing us to come in and share an update with you on where we're at with the project. Today, I'll just kind of briefly cover some project progress, a little bit about our current spending and spend down of the funding that we received in this first contract period, a little bit about the service assessment, a siting update, and a few next steps. So as you all know, the city received a 24-month planning and capacity building grant that began July 1st, 2025. So the expenditures that I'll share with you today are really aligned with an implementation milestones rather than operational stage service delivery. That'll be in year 3 contract and scope of work. So the operations phase will actually require a new contract with the state. And that's when the FY27 funding will be needed and for this upcoming allocation. As of the end of Q3 end of April, end of March was our end of our third quarter of this contract. The city had drawn down $1 million of the 2.2 million that had been invoiced through a prospective payment structure. Approximately 328,000 of those dollars have been spent to date. We did create a new reconciliation report that would be able to really see like what's actually been spent both by the city and BCJR as our primary subrecipient for this project. So we'll be able to have a much more transparent picture of what that looks like. With the prospective payment model was a bit confusing when we were trying to share this previously. So our current spending reflects the phase that we're in, which is the planning, infrastructure development, capacity building for BCJR, community engagement. The service assessment was quite a large chunk of that as well, working with PIRE and site exploration. Some of the major progress milestones to date, I would say, is BCJR moving up to have their full-time OPC director and a hiring implementation manager and engaging their OPC consultants as part of the TA process and building out the list of policies and procedures required before implementation and before services can be started. They're also working very diligently on strengthening financial and legal and operational systems so that they can, really effectively operate this center and also have a strong compliance with it as well. The city contracted with PIRE to do the service assessment, and we're really pleased. We received that late last week on Friday, and that went out live this week. It's also on our website. It is the full report. It's pretty dense because there were a lot of requirements. And so one of the other things that we are doing is we are going to be we're working with Brown University to help us take that very long report, which is very in-depth, and create some really great local resources for Burlington and Burlington residents to better understand and digest some of the information in that service assessment report, which is going to help guide our process, but also help to show us where there might be, opportunities to learn more, where are some of the gaps, like, what do we do next? And so where can we focus our energy and efforts? I know that the, media recently shared that it was, narrowed down these three locations in Burlington. I just want to be really clear that the service assessment, those three areas that were identified in the report and again on the media, those were all areas that received the highest percentage of responses in the community survey. So it wasn't necessarily that the city narrowed anything down. This was purely the results coming from the community survey that was conducted as part of this process. And we had a little over 1,500 responses. It also includes some one-on-one conversations and focus groups with different groups that were required. Siting and exploration, VCGR had engaged a commercial broker. Part of the early planning and capacity building for site exploration was to conduct a substantial real estate analysis and feasibility, as well as just looking at what are the options for acquisition, whether that be leasing or purchasing. There was a potential phase one site that was of interest earlier this winter that did move into an early due diligence period, and it was found to be non-viable pretty much within about 24 to 48 hours. So that agreement was dissolved shortly after. Would be really clear that no final decisions on sites have been made, nor was a final decision made at that point. We're really in the early stages of feasibility work. And, we did also learn of some, concerns around the process that was in place for site acquisition. And so we've been working closely with VCJR to really look at alternatives to the way that it was being done. And so that's in progress right now with city attorney and the legal team at VCJR to make that shift, as well as a budget amendment was done to not have that amount of money that was originally in the budget under VCJR was removed in our final budget approval. So I guess, that's a little bit about where we are. I'm going to pause there. I can, before I sort of jump into any next steps, if y'all are interested in that. But yeah, just.
Thank you, Teresa. I just did a search on the city's website, and all I see on the service assessment is, what it is. The PIRE report doesn't seem to be posted yet, or if it is, doesn't come up in a search. Would you forward us the link to it?
I absolutely will. It's also in the testimony.
It's okay. We haven't, it's there now. It just arrived. So, on our website. So, that's good. You're all set then. I just need to refresh and we'll be all set. Okay. So questions for Teresa. Yes, go ahead, Representative McGuire.
Thank you so much for the, what you're sharing. The request for the 1.1, within, OSAC, if that money does get allocated, how's that going to resolve any of your current immediate, barriers to launch, and how is that going to accelerate, the timing and readiness of the site? It sounds like there's a significant barrier at this time with identifying or getting a site in place. And so that's pretty much the question, is allocating this money into the bucket you already have, which is roughly $2.2 million. You've drawn down roughly $396,000. Allocating this, how is this going to accelerate or resolve any of these immediate barriers?
I'll be honest, the monies for that in H660 are not really actually meant to resolve anything. When we look at our 24-month contract we're currently in, it was designed and developed as a planning capacity building, and that year 3 or the next phase, I'll say the operating phase, would be funded by this FY27 allocation that we're asking for. It really is our goal to identify a site in 2026 and be able to be looking at operations in FY27. So these funds would ensure that through the work that we're doing in this planning and capacity building phase, which is really necessary, that we would be ready and able to open and operate. So the funding is really contingent upon actually having a site, ensuring that we would actually be operating the OPC, and that is the only time we would actually need to have those funds. So the allocation is similar to when we received our FY25 and 26 funding in this current 24-month contract. The health department had that. So when we were ready to execute the contracts, it was available. We've had our contracts for 9 months. And so when we really break it down, 9 months is actually when we look at our project plan, when we look at the timeline that we presented to City Council, which was approved. We are actually not behind schedule because you can't rush something as important, right, as siting and location. This service assessment was a critical component that had to be completed actually first. And the exploration and the feasibility testing, we have to do that, and it could take time. I think we all knew that when we moved into this project. We look at Rhode Island, it was 4 years before they opened. On Point was almost 6. I think that we are able to learn a lot from other programs, and I actually don't think that we're necessarily experiencing any barrier that we didn't expect. And we are strategizing and working together with other folks to really look at how we can continue to move this project forward.
Just a quick follow-up, if I may. Where you're going, I've reviewed the timeline, looked at that, and as from your testimony here, currently at this time, the OPC is authorized, eligible, and is being resourced for your current stage of development. And that's why I'm looking at to the way it was laid on out from the House bill with 660. It was to keep the money aside until those developments started moving forward. So at this time, from what you're saying is you're not behind schedule. You're right where you need to be, and the money that you have available fits the current resource and the need.
I'm going to ask that question just a little bit differently, but
Okay.
along the same lines. You have a 24-month planning and assessment grant with the state that started July 1 last year. And so 24 months actually brings you all the way through FY27. And so, and you've acknowledged that you've only spent $328,000 of the $2.2 million so far. And if the planning grant runs all the way through FY27, and that's the budget year that we're talking about, and that's the year that H660 is talking about, I am struggling to understand why you'd need an additional $1.1 million for something that won't be starting realistically until FY28. And I do want to say that 1.1 million, if it is held in 660, if 660 passed the way it is right now, that means that 1.1 million can't be used for any other valid project or services. And that, I'll just be honest, is a problem for this committee. So can you elaborate a little bit more on this? Because you have money that goes all the way through FY27.
Right. I think that what we're aiming for is that a site be identified and that we are opening in FY27 so that the way that the funding works, like we would be like partway through FY27. Hopefully, like, we wouldn't be at the end of FY27, that we would be looking at more the earlier part of FY27 to be looking at upfitting. I think that we all know there'll be significant cost in the standing up of any location, whatever that location might look like. There is going to be custom upfitting. There's going to be lots of equipment that needs to be purchased. There'll be many expenses that we just don't have right now. And we really look at the budget, the way it's been kind of designed out, is those expenses will be like heavy when we identify that location. And therefore, looking for the FY27 funding allocation would ensure that we know that after we've invested all of this time, effort in getting a site up and ready in FY27, that we would want to make sure that those funds are there to, make sure we have the proper staffing and that we're able to actually provide the operating service. And so I think that I wish I had a crystal ball to know 100% how the timing was going to work. Really just basing everything on what we our goals, like what we're aiming for and what we believe to be feasible, actually. So I guess that's where we're looking at this, as ensuring that we have that operating funding available to be allocated. We know it takes a little bit for contracts to be executed, and knowing that at the top of this operating phase, that those monies are there would be important.
Thank you. You said you hope to be operational in early FY27. Early FY27 is less than 2 months away, and you don't have a site located. You said that you had, those 3 areas were just the areas that sort of came out of surveys and research, but there's no actual preferred location yet. So I just, I understand, and you just said, the other 2 sites that you've learned from, took 4 and 6 years to get to the phase of operations. And, hopefully we will be faster than that. I do hope that we're faster than that. It's, for me, it's not really passing the straight face test of timing. Even though I am on record as supporting this, obviously, but I'm having difficulty with the notion that you believe you might be operational in FY27 when you don't even have an identified site yet. Go ahead, Representative Bishop.
I think my question or comment really echoes what you were saying, in that the contracting and outfitting will be the easy part when you get to that phase. And I think that the challenges faced to date, and I think realistically the anticipated challenges of finding the site, do seem like it's still some time off. So if you have any more to share with us with respect to the siting, that could possibly help us understand this request.
I should have I shouldn't have said early FY27. I was thinking that, like, by the end of the calendar year, like if we'd been able to identify the site and be moving towards the upfitting so that we would be ready to have operations start in FY27. So that was more like having that identification done, like, by the end of the calendar year. So I apologize, I said fiscal year, but I'm really meaning the end of the calendar year, because I think we do need more time, right, to identify a site. I can't say that we have anything that's currently viable to share. I mean, we really don't, but I am looking at some other, the city is looking at some other models. And I think I had mentioned, and I just wanted to set the record clear as well. I am in Canada, touring around some different programs here since they've been operating for much longer, and we'll be visiting a mobile program in Montreal, and also a fixed site, and was at a fixed site here in Kingston, Ontario a couple of days ago. This is a trip I funded myself, just so everyone knows. I think there was some thoughts around that this was being funded by the OPC grant, and it is not. I'm doing this to, learn more for the city project, but also for myself as a person in this field. And so I think that we recognize that we may have to make pivots, right, to ensure that we get this project open. We don't know what those necessarily will be, but putting all of our eggs in one basket is, also not okay. So really ensuring that we're doing our due diligence and looking at other models, other ways that we can bring this service online. Because at the end of the day, this is about keeping people alive so that they can access the other parts of the continuum of care that are going to be available at the OPC. Our phase 1 actually incorporates bringing those online. They are required OPC services outside of consumption, and bringing those online first at a larger location, which can be leased, or acquired for the OPC. So I think when I think of something like that happening in FY27, it's very, very feasible and is what we are really hoping to do, while upfitting, potential inhalation rooms and the consumption spaces. So I think that there's just a lot of different ways we can look at what beginning the operations looks like.
Other questions from committee members for this witness? Go ahead, Representative.
This is more of a statement. Back when this bill was passed, I made a statement of unintended consequences. And this are the results of the unintended consequences of moving forward without doing the appropriate feasibility study that other states like Rhode Island and California and Massachusetts, they may not have. Rhode Island's the best example. Their very comprehensive feasibility study that they enacted was put into place. You've been placed in a position to where we're asking you, or you're pretty much responsible for doing a feasibility study that this body should have done. So I commend you for the work and everything that you're putting on into this. Whether I agree or disagree with an OPC is not relevant. What's relevant is we didn't do the appropriate measurements first before enacting this bill. And this right now, what you're expressing are some of the unintended consequences that are coming on out. To get that site operational, you're talking years. And that's the truth. But I commend you for the work that you're putting on in, because you are tasked with doing something that should have been done before the bill passed.
So, Representative McGuire and other committee members who might not remember this or be familiar with it, we had a feasibility study in the bill that the governor vetoed. So we actually did attempt the feasibility study process first. And so agree that the city is faced now with doing feasibility and implementation all within the confines of one bill. But just want to point out that the legislature did believe that a feasibility study first was the right way to go. Okay, are there any other comments or questions from committee members? Okay, I just want to give Tom and Jess the opportunity to, good morning. It's nice to see you, Jess, and you too, Tom. Want to give you the opportunity to give us any specific updates that, or elaboration on anything that Teresa just shared with us.
Sure. Hi, good morning, everyone.
Good morning.
I'm Jess Kirby. I am in the position of OPC director, which I just want to start by saying, is so important to me. And I'm really proud to be a person with lived experience with opioid use disorder in that position. And it really, mirrors like what the other two OPCs in the United States, they have also people with lived experience in that position. So that feels really fitting, and really, exciting for me. Tom, do you want to say hi, and do you want me to share my screen, Tom?
Sure. Hi,
Okay.
I'm Tom Dalton. I'm Executive Director of Vermonters for Criminal Justice Reform. And Jess has a PowerPoint that she's prepared, so I think she's going to transition to that.
Is it okay if can I just screen share regular? I have permissions for all that.
I think that you're getting permission right now. And have
Okay.
you sent that to us, Jess?
Yes, I did. Yep,
Okay,
this morning.
it's under Tom's. Okay, gotcha. Thank you.
No problem. Okay, so I'm gonna try and do this. Bear with me, I'm not a tech wizard. Oh, okay,
Oh, good job.
thanks. Okay, go ahead, Tom.
Okay, do you want to switch to the first slide?
Sure.
So who we are, we operate a reentry and recovery center for justice involved people with substance use disorder in downtown Burlington. And we're the organization selected by the city of Burlington as the community partner to help them implement the overdose prevention center in Burlington. And in terms of services that we currently offer, we offer walk-in access to services, including comprehensive case management. I know this is a busy slide, but I'll let you read some of what that means. And another key aspect of the services that we're providing is a low barrier medical clinic in partnership with Johnson Health Center, so that our clients that we're engaging have very low barrier access to medical care, including wound care and infection care, on-demand access to medications for opioid use disorder like buprenorphine, including the long-acting injectable form, and really comprehensive primary care as well. And we offer a contingency management program. We try to help people with whatever they come in the door with, we try to help them with. And we have a really experienced team, really, I think, talented team, and I'm really proud of the work that we've been able to do. And I'm looking forward to incorporating the Overdose Prevention Center into that menu of options for people. In terms of who we engage with, we're currently working with over 400 high-risk people. And these are a few data points for you to see the nature of the risk. 82% report a history of overdose, and 90% were not accessing services at an existing recovery center when they came to VCGR, and 82% reported current injection drug use. I think in terms of the timeline, just as a reminder for people, Act 178 took place June 2024. We applied for the letter of intent in February 2025, and in December of last year, the city council approved the contract between VCGR and the city. So Jess, do you want to take over from this point?
Sure. I think Teresa, probably covered a lot of this, but so I will, try to breeze through some of this, but some of the things that we've been working on, it's a lot. We've been working closely with the city. We meet with them weekly, regularly. We have, explored OPC partnerships with places like UVM, Howard Center, of course, Johnson Health Center, Pathways, Vermont Cares. We collaborated with the city to, plan and facilitate an educational webinar that had, featured experts like Brandon Marshall from Brown University, Ashley Perry, who's in the OPC director role at Project Weber Renew in Providence, Rhode Island, the OPC there. We've participated in, lots of listening sessions, presentations at all the NPA wards, multiple times. We've surveyed people who use drugs to better understand their needs, use patterns, and estimate OPC utilization, and engaged with, a lot of advocates, community members, stakeholders. We've been really busy, educating the community and working closely with the community and the city to help understand community concerns and help facilitate the service assessment. So we've also been drafting policies and procedures, convening an administrative body, which is part of the OPC guidelines, working with the city on site acquisition. We hired an OPC director, which is myself. We hired subcontractors to support implementation and community engagement. We, have conducted research and program reviews. We've been working really closely with Project Weber Renew for technical assistance, and we have a contract with them. We, are working on database with them and budget development and financial planning and staff training. And I'm actually going there in 2 weeks. I'm so thrilled to be going to Providence and to see the OPC there. They told me I'm actually going to be the first person that they've ever, had in the facility, like for a training purpose, during the, work day. So I'm really excited about that. And of course, we were really, involved in the service assessment. We organized and recruited for and hosted a lot of the surveys for people with living experience. So we did a lot of that here at our office, and some were done at Safe Recovery. To make sure that we really had information from people who are likely to use the site. A couple
Jess?
yeah. Yeah.
Just before you move on, we have a question from Representative Steady. Representative
Sorry.
Steady? No, that's okay. I can't see her on the screen either.
Okay.
Hi, Jess.
Hi.
Oh, can you explain to me why you believe the Burlington Center is called a prevention center when you're actually pumping drugs into people's bodies? Can you explain that to me?
Explain why it's called an overdose
Why it's
prevention
called
center?
a prevention center when you're putting drugs into people's bodies? I'd like to know why.
Okay. So Overdose Prevention Center, there's been a lot of, iterations of terms over the years. An overdose prevention center is what the current language is around this sort of facility. And the prevention is referring to preventing overdose deaths. No drugs are provided at the facilities or people who are, actively using substances that they've procured elsewhere, and people who are very high risk for overdose deaths. So we're working to prevent overdose death.
So if they bring a drug to you to pump into their bodies and it has fentanyl and it kills, or could potentially kill them, how do you handle that?
People are using dangerous substances every day, whether they're using it 2 feet down the road, or in a hotel room or apartment alone, or behind, a building where no one can find them. I'm a person with substance use disorder myself, and I've had near-death, experiences with overdose, and I wish that I had access to an OPC, where somebody could have helped me, in those moments and helped me access treatment sooner, and all of those things. But, it's just needing to, I think a key point is to remember that we have a lot of people that are struggling with using dangerous substances in our community, and that, there's no cure for substance use disorder. We don't have control over what's in the drug supply. We just know that the drug supply is really dangerous, and we want to help people avoid dying of a fatal overdose.
Thank you, Jess. Okay,
You're
let's move
welcome.
on.
Okay. So here are just a few things from the service assessment. I'll breeze through this, but there were 49 people with living experience surveyed. Some of the staggering data points to hear about the risk of the population we're serving, we're hoping to serve, and people that are struggling in our community is almost half. 47% had experienced an overdose in the past year. 14% had experienced 5 or more overdoses in the past year. And of those who experienced an overdose in the past year, approximately a quarter were alone during that time. 43% of people reported using alone all or most of the time, which is very, very scary. Here's just some, other data from the service assessment about how people are using drugs, what their current situations are. 80% reported being unhoused, which is who we anticipate is most likely to use the center. A lot of people, using drugs through smoking or inhalation, and injecting drugs. So this is also some really promising data about utilization. 92% of the people surveyed responded that they would consider using an OPC. We've also done some separate surveying at VCJR, and you know, it's really showed, you know, well over 90% of people feel like they need one and would use one if one were available to them. 73% of people said they would use it all or most of the time, which is really encouraging and tells us that we really have an opportunity to intervene on serious overdoses. So some of the reasons people said they would use an OPC, you know, 98% of people, and people can check more than one box, that's important to know, said, you know, that they wanted access to compassionate overdose response, somebody to, you know, compassionately respond in the event of an overdose, and save their life. Access to overdose prevention supplies, 98%. Another one, I won't read these all, but 93% said access to referrals for treatment and social services was, you know, one of the main reasons they would use an OPC, which I think just says a lot about where people are and the support they need and the support that they really want. So 93% want any overdose to be reversed, to avoid fatal overdose. 91% think on-site drug checking is important. And so there's a, you know, 80% don't want to be using alone. Unfortunately, a lot of people didn't have to. This is just community survey respondents. The percentage of people who felt that an OPC, they strongly agree that an OPC would be helpful to our community. You know, 31% said strongly agree out of 10. So 14% said strongly disagree. So I cannot read this because I have like all of your faces covering this. I don't know, Tom, if you want to read this as an endpoint or if we just want to leave it up there. I don't know how to move that.
Jess, can I ask, how many on the community responses, how many respondents did you have to your community survey?
I think, Tom, do you know, it was like 1,500, right? Somewhere right around there?
Yeah, I think over 1,500.
Over 1,500, yeah.
Yeah, we have another question. Go ahead, Representative McGuire.
Yeah. Hey, Jess, how you doing? It's good to see you.
Hi.
That survey and the 1,500, was there any like demographic or any other things taken in regards to who the people were asked, what their backgrounds were? Yeah, where I'm going.
Tom, yeah, Tom, do you want to respond to that one? Because I've been talking a lot.
I think the service assessment includes, you know, all of the data. What we were citing here is a very small sample of what's in there. So you could look in the service assessment report and you'll be able to see everything that was collected related to that.
I read
But yes, there is a lot of information on that, like what people do, you know, if they live or work in Burlington, you know, what type of positions they're in. There's a lot of information about the survey respondents too.
Okay, yeah, what I was getting at is that the surveys weren't just more or less, you know, people that were accessing the current services, and they were put out to other community members, and
yes,
the responses
absolutely.
came from a real spectrum of people within the Burlington area.
Definitely a wide variety of people in the community that live or work in Burlington. Yeah.
And just to clarify about that, there were two separate surveys. One was for people with living experience who would be likely to access an OPC. And then there was the separate one for community members. And the one for community members is the one that had over 1,500 respondents.
Thank you. Representative Bishop?
Which one of those surveys identified, we were speaking earlier about there were 3 locations or areas that seemed to rise to the top from survey responses. Were those survey responses from the community or people with lived experience?
So there were questions about siting and location in both surveys. So there are survey results talking about where people with living experience feel that it would be most effective to have the OPC. And then there are questions in the community survey about where community members feel like it would be most effective. And so, you know, as was mentioned earlier, we're not saying that a decision has been made narrowing it down to any particular area or 3 areas. the media is citing the data to say that that's what the community members or people with living experience have said that they think would be the most effective. And, you know, as we move toward site selection, we are going to be informed by these results. But in terms of saying that it's, you know, been decided that it would be limited to those three, I don't think that the city has made that determination.
And I just want to encourage people, the link is in Teresa Vizina's testimony, and you click through, you can read the whole assessment. And we will also be getting, you know, whoever is sitting in these seats next year will continue to get updates on this. I want to make sure that people are focused in on our main thing is to decide whether or not we're going to allocate and reserve another 1.1 million through H660 this year. So yeah, go ahead, Representative McGill.
Yeah, can I just ask a question? And it's more to kind of highlight what we were talking about yesterday around use of funds, whether it's only opioid. Because is that okay?
Yeah.
Yeah, so I was reading the report last night, and I was really struck by the answers to the question on what substances folks had used in the past 30 days. And I believe at the top of the list, it was crack cocaine, where it was 86% of folks with living experience had used. And then I believe next was methamphetamines, I think 76. And then third was opioids at about 65%. And we've been talking a bit, there's been, I don't know, disagreement is too harsh a word, but we've been talking about how these funds should be used, whether it's only opioids or co-occurring. And I'm wondering if you could just talk a little bit about those numbers and just about how the overall kind of drug crisis has evolved and why, you know, at one time it may have really been opioids and why we might be seeing others. And yeah, just any thoughts you might have on that discussion.
You know, I'll say one thing and then Tom, you know, you speak so eloquently, I'll let you respond. But, you know, we did, you know, this was, you know, 49 people, you know, surveyed. It's definitely a representative sample, but also, you know, it's definitely not everyone. You know, you might have remember, in an earlier slide of, you know, surveying, you know, these direct clients as a whole. And I think it said like 80% were using both, stimulants and opioids at intake. So, you know, there are a lot of people that are using both, and that's really like what we're seeing a lot of, and that we've been seeing in overdose, you know, fatal overdose trends as well, that people, you know, there's been a huge increase in the number of deaths associated, you know, with stimulants as well. But Tom, do you want to say anything about that?
I guess I would just say, and I'm going to hazard an opinion here, and I apologize to people that I might be expressing an opinion that they disagree with, but you know, I've worked in Burlington with people with opioid use disorder, you know, since 2000. So through the period of time when the pharmaceutical companies were engaging in their harmful practices, and through the time when we didn't have access to methadone, we didn't have access to buprenorphine, we didn't have access to naloxone or Narcan. And I feel very strongly that the opioid settlement funds should be directed to the people that suffered the harm from the pharmaceutical companies as directly as possible. And so and also I do think that those people that have opioid use disorder and are often also using stimulants and other things are at the highest risk as well. And so, you know, my personal opinion is that the funding should be tightly tied to people who are living with opioid use disorder. And I would also add that that's the reason that I support putting the emphasis of opioid settlement funds toward treatment, recovery, and harm reduction, and not prevention, because prevention is for people who may develop a substance use disorder in the future. And to me, the opioid settlement funds are to address the harm to people that already already became opioid dependent because of the actions of the pharmaceutical companies. So.
Jess, can you take down your PowerPoint?
Yes, if I can figure out how. Do I just, okay, stop share. Okay, I think I got it.
There we
Yay.
go. Okay, thank you. Thank you, Tom and Jess. Are there any other questions for these witnesses? We really appreciate the update and the information, and we will delve further into the assessment report and all the things that it lays out there, and look forward to getting future updates from you all. Thank you very much.
Thank you so much. Have a great
Thank
day,
you.
everyone.
Okay.
Thanks.
And now, Shayla, from the Health Department, it's nice to see you again. Essentially, we are interested in the Health Department's perspective on this addition of 1.1 million in H660 in terms of timing and existing grants that you already have with the City of Burlington.
Sure. Hi, everyone. For the record, Shayla Livingston, Interim Deputy Commissioner at Health. So our recommendation in our letter to you all in the winter is the same, remains the same now, which is that they have a lot of carry forward in their current budget. We are budgeting with them a little bit differently. We're doing prospective payments so that they have access to funds if and when they need them in a slightly different way. I want to be clear that we are working with the City of Burlington, and that BCJR is the city's subrecipient. And we have both two different things. We have a set of guidelines for overdose prevention centers generally that the city is ensuring they are adhering to. And then we have the grant with the city. Teresa, I just want to reiterate one of the things Teresa said, which is that their current grant is a planning and evaluation grant. And that once they identify a site and are going to open, we will have a new grant that would be an operations grant. That's common practice and the work that we do. The timing of that depends on site identification. We do site visits with them. Right now, those site visits are virtual, but we do that with all of our subrecipients. And we do monitoring of the grant. Based on all of that information and the work that we have done with them, we do not believe at this time that they need additional funding.
Thank you. And I realize the services assessment report is just hot off the press.
Yeah.
So you probably haven't had a chance to really delve into it. But are your first impressions that meets the requirements that are laid out by the state for the city?
I do not have that right this second. I was just emailed it
Okay,
yesterday.
all right.
I'm sorry about
That's all right. We'll give you a buy on that one.
I offer appreciation to them for doing it, and we'll get back to you on the details. Yeah.
Okay. All right. Thank you. Do we have other questions? Go ahead, Representative McGuire.
Yes, thank you. Thank you, Shayla. So what I'm hearing, you kind of clarified that at this time, the Burlington OPC is pretty much resourced and their needs are being met fiscally, the resource with their current stage of development and where they're at. That's kind of what I'm hearing. Thank you.
Any other questions for Shayla, the Health Department? Okay. Thank you, all four of you, for being here this morning. We really appreciate it. And we'll see what happens on H660. So thank you for giving us this update. We really appreciate it.
Thank you.
Thank you.
All right. So I see our next witness is here. And yes.